I've battled my weight all my life. I have a 9-year-old son. When he started school, I thought at 141 kilos that I am not going to be around to see my little boy graduate if I keep going the way I'm going.
We all value and cherish family, friends, and the chance to be active and enjoy life. Chronic weight problems are a disease. It is a disease that affects 8% of the Australian population. Those who suffer from it know the frustration and health problems it brings. Lap Surgery Australia understand this and offer a procedure that provides relief and a bright future for those who struggle with chronic, severe weight issues and abnormal hunger drive. A relief that diet and exercise alone cannot bring. Certainly the consideration of lap band surgery is both brave and positive. It is the start of a journey to a new and brighter life. Seeking help from Lap Surgery Australia is a chance to sit and talk with experts to discover the benefits the procedure can bring. Lap Surgery Australia are experts and understand what it means to suffer from this condition. They understand many people have battled chronic weight problems all their lives. This disease causes many terrible social and health consequences and is the second biggest cause of preventable premature death in this country. There is a choice. Lap Surgery Australia can provide the solution to your weight problem by performing lap band surgery. How it works is actually very simple. The band is placed just below the junction of the gullet with the stomach. This forms a small new stomach that the food is slow to pass through. When the balloon of the band is inflated, it restricts the passage of food into the larger stomach, thus greatly reducing the volume of food that can be eaten and slowing down your eating. The distension causes signals to be sent back to the brain to stop your hunger drive. Lap Surgery Australia have performed this life-changing procedure on many over the past 10 years. Their experience, history and finely tuned expertise ensures you are comforted and guided through the process. Best practice and standard of care is taken to make the procedure comfortable so you can look forward to a healthier and more active you. A life-changing step is exciting and the benefits it brings have already been experienced by many.
Got rid of diabetes, high blood pressure and sleep apnea. Being a woman, the vanity factor comes into it with clothes and shopping and sizing and whatever else, whereas I couldn't do it before. I did not want to go out the front door.
High blood pressure, glucosamine tablets, fish oil, gout. Now all I take is one tablet, which is a multivitamin. I don't have gout, I don't have sore joints or anything like that at all because I've lost 68 kilos. The support from Lap Surgery Australia has been fantastic. It was there before you had the operation done and it is there now and it will be an ongoing forever and ever.
And the thing I think most is how much more energy I've got, how much more joy for life I have. The things I do now that I would never have considered doing beforehand.
I'm a happier person. I think I'm nicer to work with because the self-esteem issue, you know, your self-esteem has just risen so much, and I think I'm a better person all round, really.
And you don't need to be embarrassed about your weight issues. Everybody there knows exactly what you're going through.
Lap Surgery Australia. We would like to walk with you.
I was just sweating excessively under my arms, so it affected me because I couldn't wear the same clothes that I would normally wear. I couldn't wear shirts or any tops which would show the wet patch. So, you know, every time I went shopping, I had to be very selective about what I bought.
Excessive sweating and blushing are socially embarrassing conditions which can have a devastating effect on quality of life. Excessive facial blushing, palmar or axillary sweating is caused by overactivity of the involuntary nerves. In selected cases, a new surgical procedure can be used to control symptoms with minimum pain and quick recovery. Lap Surgery Australia provides an extremely effective solution to excessive sweating and blushing using endoscopic thoracic sympathectomy, or ETS. This groundbreaking surgery is providing people who suffer from either of these conditions not only with new hope, but in many cases with a new life. The symptoms of sweating and blushing can be made worse under many circumstances, including stress or embarrassment. But in many people, it occurs in response to even the most trivial trigger events and is often accompanied by other symptoms, including palpitations, feelings of excessive heat, and anxiety. In selected cases, ETS surgery with Lap Surgery Australia is a good option for treatment of these conditions. This keyhole approach to surgery is easier on your body when compared to open surgery methods. Keyhole surgery involves small keyhole-sized incisions being made under the armpits. A thin tube called a port is used to introduce a tiny video camera. This is used by the surgeon to view the sympathetic nerve on a video monitor. The operation involves selectively isolating a small part of the sympathetic nerve on each side by clamping the nerve with small titanium clips which stay in place permanently. These clips are routinely inserted in the body in numerous other operations and have no known side effects. This technique has a good success rate, greatly reducing excessive blushing or sweating. As in all surgery, there is an incidence of side effects, which will be discussed in detail in a face-to-face interview with our surgeons.
Mr. Hensman went through everything with me and explained that, I needed to make an informed decision. He went through all the different risks and I was quite comfortable.
The smaller incisions used in keyhole surgery lead to faster recovery and less pain. Lap Surgery Australia specialise in keyhole surgery and have been performing this procedure and training surgeons in this technique for over 10 years. Their experience ensures you are comforted and guided throughout the entire process. Best practice and standard of care is taken to make the procedure comfortable, so you can look forward to enjoying a speedy recovery and a new, greatly improved quality of life.
Just all of a sudden, I stopped that feeling and I just felt dry. And then since then, that's how I felt every day, and it's just been fantastic, yeah.
Let Lap Surgery Australia unlock the door to a new you.
I was operated on the 22nd of October, which is only 9 days ago, and after about 2 days I had no discomfort whatsoever. I had no pain to speak of.
We all value our health and well-being. It is the foundation our enjoyment of life is based upon. No one has to suffer the pain and inconvenience a hernia can bring. A hernia is a medical condition that can result in extreme discomfort and serious complications if left untreated. There are 3 types of hernia that can be treated with keyhole surgery. They are groin hernias, hiatus hernias, and incisional hernias. 1 in every 20 Australian men will develop a groin or inguinal hernia at some point in their lifetime, and many Australian men and women have hiatus hernias. Hiatus hernias can cause severe heartburn and extreme discomfort due to acid from the stomach coming back into the esophagus, and they are associated with gastroesophageal reflux disease, or GORD. Incisional hernias occur in people who have had an operation on their abdomen, where the stitches have failed and a protrusion of abdominal contents has occurred, causing great discomfort. Lap Surgery Australia provides an effective solution to each of these hernia conditions by using keyhole surgery. This groundbreaking procedure greatly reduces pain and scarring and minimises the chance of any of these hernias recurring. Hernia surgery is a common procedure. Around 45,000 hernia operations are performed in Australia every year. The small incisions used in keyhole surgery ensure a quick recovery, resulting in fewer complications and an earlier return to work when compared to the old open hernia repair methods involving large and very painful incisions. This means you can get back to living your life pain and discomfort-free much more quickly. Whether the hernia has occurred in the groin, is a hiatus hernia or an incisional hernia, surgery is the only way to repair it. Keyhole surgery is by far the most effective and safest choice for any of these hernia problems. Lap Surgery Australia are specialists in keyhole surgery and have been performing keyhole hernia repair and training surgeons in this technique for over 10 years. Their experience and expertise ensures you are comforted and guided throughout the entire process. Best practice and standard of care is taken to make the procedure comfortable so you can look forward to healing quickly, enjoying a speedy recovery.
I had the symptoms of the an inguinal hernia on the right side. I expected to have to do it the traditional way, visiting Mr McHenry's rooms. I picked up a brochure that described the endoscopic method, and I thought this makes a lot of sense, and this will probably save me a lot of time and discomfort.
I originally had my hernias repaired bilaterally about 28 years ago, but at the time it was done by conventional surgery. The initial discomfort was a lot more than this time, and before I could resume normal activities would have been between 5 or 6 weeks. Now, this time I was amazed. I mean, I knew that it was going to be better, but I really did not expect it to be anything like as good as it was. I really didn't. But less than 24 hours after surgery, I was home.
I was first diagnosed in the early 1980s with a hiatus hernia. I couldn't eat or drink without vomiting. I did consult my doctor, and I asked him if there was any operation available, to rectify the situation. So he suggested that I have a gastroscopy to just see exactly what the problem was, which I did, and the gastrologist diagnosed the problem quite accurately, but he just sent me home. It eventually came to the point where I just couldn't eat or drink without vomiting, so I admitted myself to the Docks private hospital, and it was decided that Mr Gilholm could operate on me using keyhole surgery, and I'm delighted to say that the operation was immensely successful, and I experienced very little after effects. In fact, I think it was he sent me home after 3 or 4 days, and all I can say is that I'm so grateful to Mr Gilholm for what he did, and I'll always will be. And if as a result of this little discussion that I could influence someone who had this condition to consider this procedure, I'd be delighted.
Let LAP Surgery Australia unlock the door to a new you.